Hello, everyone. I'm currently in the territory of the Heiltsuk Nation in the central BC coast, and more specifically, the community of Bella Bella, where I'm doing a locum. That's why I'm grateful to the conference organizers for allowing me to record this session, because my internet connectivity and availability wasn't certain. It's a real honor to have the opportunity to speak to you about data-driven learning in the BC Emergency Medicine Network. Before I start, though, I should tell you that I do receive funding from the EM Network as Scientific Director, and that partly supports my UBC appointment. I don't believe that financial relationship affected my choice of content for this presentation, but I'll leave that to your determination. In terms of goals, at the end of this session, my hope is that you'll have a better understanding of the key components of a learning health system. That's a concept that I think all of us need to be familiar with in healthcare. I hope you'll also come to learn a bit more about the EM network, and more specifically, our ongoing evaluation of the HEiDi program to layer virtual physicians onto the 811 line. And finally, I hope you'll understand how the Heath Data Platform has the potential to revolutionize data-driven learning in BC. Well, we all know that emergency medicine is incredibly broad and incredibly complex. This word cloud is from titles at UBC Emergency Medicine Research Day over the last 10 years. But in addition to that complexity, we have a situation where there's a wide range of practitioners and resources across the province, and yet any problem can present itself to any location at any time in BC. That's a big part of the reason why the EM network was established 4 years ago, with the goal of exceptional emergency care everywhere. And if you've never been to the EM network website, I'd encourage you to go there. You'll find a huge amount of resources, and you'll see that there are 4 major programs: clinical resources, CPD, real-time virtual support, and research and innovation. Membership in the EM network now stands at over 1,000 physicians across 88 sites, and we're expanding to nurse membership and nursing content. But all of that activity that I mentioned and those 4 programs all have goals related to improving the system, things like reducing variability, reducing morbidity and mortality, and reducing costs. And to assess that, the scientific program is challenged with a real issue, and that's the lack of timely and linked data. It makes it really hard to actually evaluate the network itself. That's where the concept of a learning health system comes in. So what's the problem with the status quo? Well, here's a graphic from the Institute of Medicine from 2012, and it depicts how with science, insights are often poorly managed. They lead to evidence, but that evidence is often poorly used. It leads to care, but that care experience is often poorly captured, and that all adds up to the patient experience. Here's what would be better: a learning health system. That's where science, informatics, culture are all aligned, along with incentives for continuous improvement, innovation, and best practices are seamlessly embedded in the delivery process, and new knowledge is captured as an integral byproduct of the delivery of care. In other words, we deliver care, we capture data and information on it, and that information cycles back to improve and influence that care. Well, let's switch gears and talk about one of the major programs within the EM network, and that's our real-time virtual support program, and more specifically, HEiDi. To understand HEiDi, you need to understand HealthLink BC. And that's a major part of the healthcare system that I suspect, if you're anything like me, you probably don't know a lot about. And I'd encourage you, if that's the case, to go to HLBC's website and learn more about it. It's a massive operation. The biggest thing it does, of course, is it manages the provincial 811 line. So that line is where anybody can call any time of day. They can be connected with a nurse, a dietitian, an exercise professional, a pharmacist. They can get health-related advice. And since last year, and since the COVID pandemic, they can be connected with virtual physicians. So how did it come to be that virtual physicians got onto the 811 line? Well, when COVID came along, call volumes went up 7-fold to 811. And many of those calls were complex, they were related to COVID, and that presented an opportunity for physicians to collaborate with nursing colleagues to layer physicians into the line itself for selected callers. In fact, we had experience in that from a previous pilot project about 6 years ago. Well, you'd be probably surprised to know that last year, 811 received over 900,000 calls. And of those calls, almost half were referred to a nurse. And of those calls referred to a nurse, about 20,000 were referred to a virtual HEiDi physician to either be managed verbally or with video link. We know a lot about the processes of the HEiDi program. In fact, we completed a process evaluation that's just been accepted to CMAJ Open. We have a good sense of the call volumes per month and their distribution. You can see that early in the program, it was all yellow calls. That was where the nurses felt the caller should be seen within 24 hours. In November, we toggled to also include red calls. Those are the calls where the nurse designates that the caller should be seen in an emergency department or by a physician in their office within 1 hour. We also know that when callers are referred to the HEiDi physician, about 3/4 of them are downgraded to a less urgent disposition, either to schedule a healthcare appointment or to manage things at home. But similarly, 16% of them are upgraded to attend the emergency department now. And we also know that caller satisfaction is huge. Invariably, the feedback on the HEiDi program has been exceptional and positive. What we don't know is whether it's really making a difference to the system, whether it's cost effective. And to know that, we need hard outcomes, and to get those outcomes, we need data. Well, that's where the Health Data Platform comes in. So the Health Data Platform is a new initiative from the Ministry of Health. It's separate from PopData BC. It pulls in data from multiple locations into a secure environment and a single entry point for rapid assessment by policymakers and system designers to influence their processes. And this has the potential to revolutionize things. And we were quite thrilled in January of this year when the EM network was one of just 2 clinical entities to receive permission to access the Health Data Platform to evaluate the HEiDi program. This data is rapidly refreshed. It's much more streamlined and easy to get than traditional research data requests. And so we intend to look at 5 major issues related to the HEiDi program and the HEiDi's ability to reduce avoidable visits, accelerate referrals when needed, do so safely, increase caller attachment to their family doctors. The HEiDi program is not intended to replace family physicians, and ultimately save the system money. We've developed an early priority primary question related to red designated callers, so they're referred to virtual HEiDi physicians, and what are their 24-hour and 7-day healthcare system utilization and outcomes categorized by the HEiDi physician triage category. And so over the next few months, we intend to assess that question using 9 linked databases. And you see those databases in front of you there. So we'll be able to follow the journey of HEiDi patients very clearly after they interact with virtual physicians and know what interactions they've had with the healthcare system, whether they've been admitted, whether they got more sick, even whether they died. And so by the end of the summer, we hope to have a very granular understanding of those red category patients. We plan to go on from there and look at other categories of patients and also do comparative assessments. So let me close by talking about the future. I hope that this presentation has illustrated the potential of the Health Data Platform to revolutionize rapid data access to linked, refreshed data in British Columbia and enable entities like the BC EM network to truly function as a learning health system. My longer term hope is that not only will we do a great job of evaluating the HEiDi program and will give good information to the Ministry of Health and HLBC, and that will guide them on the evolution or continuation of the program, but also that we'll show ourselves to be good data stewards. And in doing that, facilitate the ability of the EM network to access the HDP for many of our other major innovation programs, because they all have the same need for timely linked data. So I'm going to stop there, and hopefully I'll be able to join you in real time during the panel discussion. Thanks very much.